Diane, go ahead.
Okay, so explain quickly, what is TAVR exactly?
Oh, great. I'm glad you asked that as an introductory question. TAVR is a transcatheter aortic valve replacement procedure. Basically, we're replacing people's aortic valves without cracking open the sternum and putting them on a pump run. So if somebody has severe aortic stenosis where their heart valve doesn't open and is unable to supply blood to the body, then we could go in through the groin usually, but sometimes also through the arm artery called the subclavian artery in a much less invasive way and place a new valve for them so that they could have an open functioning valve again.
Who's a candidate for TAVR?
So a lot of patients ask us this question. They heard that there's a new technology and they hope that they could forego open heart surgery and that everybody could be treated percutaneously. But the answer is that the FDA and CMS and the payers and the insurance companies have only approved it for those patients who are deemed exceptionally high risk for open heart surgery. Now, what that means is that if the patient has bad lung disease or other comorbidities that make them very high risk for being cracked open and going through the open heart procedure, then this may be for them. The reality is that open heart surgery for replacing aortic valves has a long track record of success and is a great surgery, so this is not for everybody. Some of the patients could still be treated in that fashion. This is for those patients that are high risk, and now the bar has changed such that patients with intermediate risk may be appropriate for TAVR also. In addition, there are some anatomical considerations, and that's why we get a high-resolution CT on every patient that comes through the door and may be appropriate for TAVR to see if it will fit their anatomy.
So prior to having access to this type of procedure, if somebody was high risk for surgery, what was their outcome?
So this technique was developed in the last 10 years. We only got it in Bay County in the last 6 months. Now, prior to 10 years ago, patients with severe critical aortic stenosis who were very symptomatic could undergo balloon aortic valvuloplasty, which made them feel better for a few months, but then the disease would progress and usually it results in death. It could just present with heart failure or chest pain or passing out initially, but the end point is usually death. Now, once that was approved and started being used in universities, we found that a lot of our patients wanted to be sent elsewhere so that they could receive that technology rather than get the inevitable poor outcome. Now that we have it here, we don't have to send people out of our town or out of our state any longer. We could do it right here at Bay Medical Center.
So how big of a deal is it that a place like Bay Medical can offer this?
It's a game changer. It's the first thing that I've seen since I came here where we have the whole team working together. We've got surgeons, interventional cardiologists, the echocardiographers, the anesthesiologists. We've got a heart team, a heart valve team where we could serve these patients right here in their home, recover them here for a few days in the hospital, send them home for close follow-up with us, and not have to send them far away. In fact, in more than one case, we lost patients who were waiting to get their turn at the universities. So now we could attend to them here in a prompt way and take care of them before they deteriorate.
So how unique is it that a community hospital can offer it?
Yeah, and that's a great question. And in our town, this is a great, unique offering, and I think it's going to be the only place around here for a long time to come. It really depends on volumes. CMS, again, going back to the payers and the FDA approval process, made very specific rules as to how to qualify, both from the hospital perspective but also from the physician-provider perspective. And there are certain thresholds that have to be met. For example, the hospital must do at least 50 aortic valve replacements per year. Otherwise, certainly they're not high enough volume to support that sort of complex procedure. As an operator, we had to go through rigorous training and criteria as well. Otherwise, we would not have been approved. So we just had the right people at the right time in the right hospital to make this happen.
Okay. Can you talk about who are some of the team members? Not necessarily in names, but what are some of the people that had to come together, specialists that had to come together to make it work? And kind of say it like it took a lot of specialists to come together, including...
Well, in order to make this effective and in order to have this program, it took a lot of specialists coming together, including cardiac anesthesiologists, interventional cardiologists, and also surgeons, cardiothoracic surgeons. And in each case, we had to have an interest and an expertise in valvular heart disease and had to go through rigorous training, which included going to Houston to be trained and prepared to do this. We also had to have a background of structural heart disease knowledge. And so, in addition, there are OR staff, there are anesthetists, there are echocardiographers, and behind the scenes we have quality control people and all sorts of people documenting the patients who come through the procedure and how their outcomes are. And it's a very big team. I mean, we have a meeting every Wednesday morning at 7 a.m. and there's about 30 people around the table. So you may see a few of us on these sort of interviews, but there are a lot more behind the scenes.
What is the process for a patient who is determined to be a good candidate? What
So
do they have to go through before they can actually have the procedure?
great question. So I urge the patients who are hearing about this before their physicians may hear about this to let their physicians, their primary caretaker or their cardiologist know that I'm concerned about my heart, I'm concerned about my valve, and to bring up the topic. I heard there's this new offering at the Bay Medical Center, and may I see the cardiologist or the surgeon to be evaluated. As long as they get to cardiology or cardiothoracic surgery, we will then refer them to our valve clinic where we do things like echo, CT scan, pulmonary function testing, and 2 layers of evaluations by 2 separate surgeons if the patient qualifies. If they don't qualify, there are a lot of other things that we do through our own office.
Okay. Now let's go, unless there's something else that I missed, let's do a couple of like
Good.
shorter clips. Like let's talk about, let's do something like, what is it, only 10% of hospitals in the country can offer this, and we're just really fortunate to
Okay.
that we're able to offer this here at Bay Medical in Panama City.
What's the question that could lead to? Just say it.
Just say it.
All right. Only 10% of hospitals provide this service in this country, and we're so fortunate that we're able to provide this here at Bay Medical Center in Panama City.
Okay. Any other like short ones you think of that we need?
I would say something about comprehensive heart center. This is like really important. It's yet another part of that.
Yeah.
Could you word it for me before I say it? Because I'm not sure. You know how the competition, for example, they don't even have heart surgeons, but not only do we have open heart surgery, but now we even do percutaneous valves. I mean, this is the comprehensive.
Yeah.
This is one more example of how.
How about starting off with, Bay Medical has long had a commitment
Okay.
to being a comprehensive heart center, and
Okay.
this is just one more step.
Okay.
You know, we've had open heart surgery, we've had really advanced interventions,
Yeah.
and now we can offer this.
All right. Bay Medical Center has always been committed to being the premier comprehensive heart center in this region. And this is just one more step in one more example of how that commitment has worked out. For example, Bay Medical Center has had open heart surgery capability and availability for years. And they had dedicated cardiac ICU. From the interventional perspective, many unique offerings such as the Impella heart pump, the rotablator therapy, ablations, but now we even have percutaneous aortic valve replacement, which means replacing patients' aortic valves through the groin, which is a wonderful technology.
That's awesome.
You
That's
say the last sentence, talk about replacing, because you sort of stumbled on the word replace.
I did.
Replacing. So just say the word again. I can just say the
You're,
sentence.
you're very talented when you do that, but I don't remember the sentence. I just know I said
Well, just
report.
say-
I was going to say repairing, and then I changed to replacing.
Yeah, just say
'Cause,
something about, it's important about replacing your filter.
Okay. Which includes replacing the aortic valve through the percutaneous approach. All right.
So you got that footage I sent, you'll be able to kind of splice and dice with some of that,
Yeah.
those
Well,
little
hopefully
clips.
you'll come over and we can just.
Ah, well, that'll be Debbie, not me. but-
Okay.
yeah.
Mine's gonna be
But I'll help you.
transcripts.
I'll be happy.
Okay.
That it?
All right.
I think so, unless we can